we're talking about everyone can apply at that point in time. There are different qualifying events is often the terms that are used, that throughout the year, even if you don't apply during open enrollment and you lose your job, or your spouse loses a job and you're on your spouse's insurance, or a child is born, or you get divorced, there are opportunities to enroll through the marketplace for those types of opportunities.
Will, just to follow up on that, will there be on the marketplace healthcare online service, will there be questions that you will be able to input on leaving my employer on March 30th? So I'll need insurance starting April 1st.
If you've seen the navigator question, I mean, if you've seen how the input is, I haven't gone through the training.
Okay. What's going to happen is the first part of your experience will be establishing your eligibility. And based on the questions, your answers to certain questions, the system will return, yes, you're eligible, no, you're not. A lot of that will be based on information that is stored in other databases. For example, it may check, the IRS database to see what your adjusted gross income was last year. So if that information leads to a determination of ineligibility, then that would trigger an appeal process if you decided to appeal. All of that takes time, and in the meantime, that 3-month clock would be ticking to where you don't want to have more than a 3-month gap in coverage, because then that could subject you to penalties. So if you think that there's going to be any type of lapse in your coverage, the earlier you start, the greater the chance that you can make the application, get the eligibility determination back, and respond to that determination all within the required time.
And I just want to respond a little bit to penalties only kick in if, one, you can show, if you were able to afford insurance and you choose to take the penalty and not avail yourself of the Affordable Care Act, which ultimately could end up being the same price and getting you health care. So I think we need to be really careful about that. You may be exempt from penalties if you were eligible for the Medicaid expansion, but your state is not offering it. And there's also hardships that you can show. So for example, your income may demonstrate, might appear that you're eligible for health care, but if you can show, because of your housing costs and your utility costs and other hardships, that is also a way to show that you're not eligible, that you would not be subject to the penalty. The other thing I want to mention too for folks, especially if you're a parent with children and you're applying, you might be eligible for the Affordable Care Act and subsidies, but at the same time you're going to be assessed because your child might be eligible under the Children's Health Insurance Program, which is our children's health insurance program under Medicaid. And that eligibility is much higher. For children who live in families that make $46,600 a year now, you could be eligible for the Children's Health Insurance Program. That means you don't have to pay a premium and your child can get fully covered. So when you're applying, if you're told you're applying for family coverage, but you may be told, wait a minute, just get coverage for you because your child could get fully covered at no cost for the Children's Health Insurance Program.
And just to piggyback on that, that's one of the reasons that you want to apply online, if at all possible, because with the paper applications allowing for mail time, everything just takes longer.
And
That's
where's
a
the
quick
mic?
question, actually. Those of us who have employer insurance, we actually use pre-tax dollars. You guys know at this time, actually, if the new ACA, if my employer decides to drop the insurance, will it be pre-tax dollars or post-tax dollars?
It's going to be based on your modified adjusted gross income. They're going to look at your tax return. That's what's going to be used. Now, I will say, when you're going into the exchange and you're having it calculated, it's really important to make sure that you're not trying to understate your income as you're going through it, because if you get a subsidy and it's determined that you actually made a whole lot more money than you provided as information, then you could end up with owing taxes down, the following year when you file your returns. So the MAGI calculation is the modified adjusted gross income, and actually there's some wonderful calculators on both healthcare.org and on Kaiser Foundation, and we'll make sure that those two sites are up there so you can go forward and do those calculations.
Yeah, and actually, sir, was the question about how they would determine your income, or if you could pay for your premiums and have that deducted from what your taxable income is?
Today, for example, when I pay premium, it actually comes before the taxes are calculated.
Yeah, I think like with state
so
government
if I'm
workers,
making
have money
$1,000,
plus, so it's not, so it's that, do we know that?
So if I'm making $1,000 a month, actually, if I pay insurance, and then from that, I pay the taxes.
The
Pre-tax.
challenge with that is it's going to be based on your employer. You have some employers that have taken the stance that they're not going to have coverage, they're not going to offer coverage. You have some that are saying that they're going to continue to offer coverage, and then you have some in the middle. And some of the small businesses that we have spoken to already, they're willing to
I'm sorry.
they're willing to pay, where they'll take it out of your check as a pre-tax, and they'll send it. They're just not offering the actual coverage. They're not setting up the plan where they offer the coverage. But if I have a small business and I have 10 employees in that business who are looking to get coverage, and it has to be set up, because you have a small business, you have flexibility in doing that. Now, the challenge with that, like I said, is based on that business. Businesses, just like us, are kind of concerned and are afraid about what's happening. So the better they're informed and the better they're educated, they'll realize that it's not going to necessarily hurt me to make sure that John and Susie have coverage, because if John and Susie have coverage, John and Susie can come to work.
And yes, just to clarify, we were talking about post-tax income. Our resident healthcare
Yes.
economist corrected us.
Hi, I just have a quick question. Is it too late to become a navigator? What is the training? Where do I sign up?
Well, I know there were 3 federal grants awarded in South Carolina for the organizations that will be training navigators. I know you can speak for one of the organizations.
No, it is not too late. If you would like to see me afterward, I'd be happy to tell you about our process, unless there are more people who would like to hear what we're doing. Okay. All right. In order to access the training site, you have to have an ID. So as a navigator provider, I could assign you an identification number that would allow you to take the online training. There are 14 modules, all of which are concluded with an exam that you must pass with a score of 80% or better. When you get to the end, then I am notified that you have reached that point, and that is when you would complete an application for employment, and that would also give us permission to do the background screen. Assuming that comes back favorably, then we could talk about whether or not you wanted to still proceed to the next step to actually go to work as a navigator. And if you did, then in your first paycheck as a navigator, you would be reimbursed for the training time. We are looking to, ideally, we want to have people available to provide navigation services between the hours of 8 a.m. to 8 p.m., which means we need a lot of people. They're part-time positions. Of course, they're temporary positions because the window for enrollment does close on March 31st, except for people who have life-changing circumstances after that date. But at that time, we would need a much smaller workforce. So if you are interested, please see me afterward, and I can talk with you about, I can give you my contact information, or you can reach me at hiec@coopmin.org, and we can, I would really like to schedule a conference call for everyone who's interested so we can go over all of the requirements, the expectations at the same time, and then those who would like to receive an ID number, we could talk about that afterward, okay?
I had a question for York Glover. You mentioned some places where we can go and apply in person for the coverage. Where were those places again?
We have 22 sites. Eau Claire has 22 sites.
Just a second. I think
Oh,
some
I'm
people
sorry.
had trouble hearing the question.
Okay.
Basically, it was where are those places where people can apply in person and help and have that in-person interaction with helping to select coverage?
Okay, we have 22 sites in Richland, Lexington, Fairfield, and Newberry. And in each of those sites, there's going to be someone there that will be certified if you wanted to get questions answered or if you wanted to apply you'll be able to do so. In addition to that, I know that Cooperative Ministries also on Beltline will have people that will be there throughout the day also. We will also be doing different events, and as of October 1st, if you look on our website, it's ecchc.org, ecchc.org. Yes.
Can we put that on the website?
Say again?
We'll put that on the library's
Yes.
website along
Yes,
with the information.
that's good. ecchc.org. There'll be a link to different events that we will be participating in. I will go ahead and give you our schedule for September right now. September 21st. And you can't enroll, but there's information, okay? September 21st, there'll be an event. There's a music festival that we will be at and partnering with other agencies. September 24th at the Palmer Funeral Home on Fontaine. There will be another forum similar to this where you will have a panel and question and answers for folks where there's more information that will be involved. More information given. September 29th, St. John's Baptist Church is having Praise in the Park in Earlwood Park from 9 to 3 that particular day. And that's about 48 hours before you actually can enroll. And October 9th through the 20th, you can find me or someone, and I saw a couple of my teammates in here. How you doing, Mr. Noble? We will be at the South Carolina State Fair for the duration of the fair from 10 a.m. to 10 p.m. So as people are going and buying cotton candy and sausage dogs and getting their stomachs, and please somebody buy me a deep fried Snicker. But as people are doing that, if you want to come in, and that's going to be during the enrollment period. So you can get information at that time, but you can also enroll. And as we have more events that's coming up where we will be in the public, in addition to the 22 sites that we're all automatically going to be in, we'll put that out there as well. Okay? Oh, Richland County, we have sites 1228 Hardin Street, 4605 Monticello Road. I'm just trying to remember the addresses to some of our sites. But we will make sure our website is going to be attached to the library's website, and we'll make sure that we have all our sites there. Okay? And also the information if you wanted to get in contact with me or anybody else on the team as well.
Okay. Next
I
question.
have a question in reference to the application. If you do a hard copy application and send it in the mail, or if you do an application in person, who will be the individuals who will be taking that information and entering into the different databases and computers for the insurance?
In case, was everybody able to hear that question? No, okay, and the question was, and please correct me if I'm wrong, but if you send in a mailed application, or if you go in and you talk to someone in person, particularly if you're mailing it and it goes off, who's going to be entering in that information that you put on the application? I think with the federal, it would, if you mail it to
That
the
would go to
federal
CMS.
government, one of their employees,
Yes, that goes to CMS,
to CMS, yes.
Centers for Medicare and Medicaid Services. Yes.
Okay.
Just to go back to the earlier question, additional locations in Richland County will be the South Carolina Progressive Network at 2025 Marion Street from 11 a.m. to 6 p.m. Monday through Friday, yes. The Cooperative Ministry, which is at 3821 West Beltline Boulevard, and that'll be 9 to 5 initially, but we expect to extend the hours as we get closer to the end of the enrollment period. And also the Greater Columbia Community Relations Council, which is located in the Chamber of Commerce building on Richland Street. And I'm sorry, I don't have the exact street address, but it's right across the street from the courthouse.
Yes, and again, we will make sure that the library has all this
Yes.
information available on their website. They've been working very hard to get resources together, and we're learning more and more. So I know everyone's scrambling to write everything down. We will get that up there just as soon as possible.
Can I add, and I know you have a question, sir, because I see you. I do. There's something that's called Champions for Coverage. Okay, and there are organizations such as ours that are working to help people get coverage and make sure they're getting educated. But there are other organizations that may want to help, that may want to volunteer, that may want to give access, whether it be for meeting space or whether it be for training sessions. So if it's a civic organization that you're a part of, if it's your church, if it's your place of employment, if it's the Boys and Girls Club that your kids go to and they want to be champions of coverage, they can also apply through CMS to say that we want to be champions for coverage. So we can be a place, we can be a hub for folks who want to come in to get coverage or to get information where they can actually come in. This is a community thing, y'all. This is not one person or two or three organizations trying to do something. You know, I was raised where, you know, if I got in trouble in school, the principal spanked me, my grandma spanked me, and then when I got home, my mom spanked me and my dad spanked me. Now, I'm sitting by an attorney, that's like double jeopardy, triple jeopardy, I don't know what it is, but, yeah, but the fact of the matter is there was an accountability that went beyond just being at school, and it went all the way up, and then when I got to church, you know, my pastor already knew about it, and he scolded me. That's a community thing. So when it comes to what we're doing right now, it's a community thing. So as much as we can be involved, whatever part we can play, it may be 2 hours that you play in the next 6 months, but those 2 hours are going to be valuable in helping someone else get the information or the coverage that they need.
And those champions for coverage, we asked for a list of it this morning, but we didn't get the whole list of everyone from CMS. But we were assured that on the healthcare.gov website, where they put the button for Find Local Help, the navigators, the health centers, and those champions for coverage will be added. And as soon as that information is available, we will be collecting all the Richland County folks and adding them to the library's website for that. I know some people have to leave since we were originally scheduled to end at 8, but again, we're going to answer as many questions as possible. Just if you do have to leave early, if you could please fill out one of the evaluations. Good, bad, the ugly, wonderful, fabulous. What did we not say that you wanted to hear? We truly want all of your feedback, and let us know what needs to be covered and what information that you need, because as Roberta said in the opening, this is the first of many sessions, and we need to know from y'all what it is to cover in the future. So with that, I know we've kept putting you off, sir. I'm very sorry.
Is it my birthday yet? What I'm seeing is that they're drawing everyone in to get enrolled as quickly as possible, and I'm seeing this huge logjam coming at us all as we're all trying to get benefits at the same time. Is there one avenue that you think is going to be more accessible than another? Are websites going to crash? If we send in paperwork, how long is that going to take to process? You've given us 4 different options to get through. Everyone's going to be doing those things at the same time. It's going to get nuts.
It will be nuts, I think. It will be crazy. That's part of the reason they have the 6-month period, is to help spread that out, but there will be hiccups along the way. This is a major program that is being started. The best we can do is to remain informed as a community and everyone work together and provide that information. But I don't know if anyone has anything to add with that in terms of the best method, but there will be hiccups.
And I do think online, for those who are computer savvy, is a great way, especially if you can work with the navigators. They can help you get the information in. You know, no one's saying there aren't going to be some stumbling as we go along. And this is a huge change. There's a huge need out there. But I ask folks, if your initial foray into it is a little bit confusing or not as exemplary as you had hoped, don't give up, because having yourself covered with affordable quality health insurance is worth every minute of it. And please help those also who might be finding themselves a little frustrated. There's a lot of people in need, and it's going to take a little bit of time, but I think it's going to all be worth it.
Thanks for taking my question. I'm currently employed, but I may be going on to COBRA. So it sounds like I'll be in a situation where I could look at staying on COBRA, which is quite expensive. It's great insurance, going through the Affordable Care Act, or also seeking my own insurance through the private market. Can I still seek insurance through the private market, or do I have to go through the Affordable Care Act? And is Affordable Care Act actually private through private companies? That was very unclear to me. And just one other little part, will the Affordable Care Act, if I went that way, can I still have my same doctor?
It depends on which plan you choose. If you decide to go to the marketplace, and that's one of the one of the criteria that we can help you with as far as
I'm sorry, what is the marketplace?
the marketplace is where the Affordable Care Act, well,
The exchange.
yeah.
Because I look at the marketplace as if I go on my own to go to a company and ask what their rates are and then compare it. I can still do that as well, right?
You can
Yes.
certainly do that.
So what's the advantage of Affordable Care Act if I could find something on the
And
open market?
It really just depends on your individual situation. I would encourage you to do both, because it's a comparison shop and see where you can get the coverage that you want for the price that you want to pay.
I believe, I know Sue had, but the subsidies for, to help with the premiums
Yeah.
and some of the other things will only be available through the federal marketplace. But yes, there are private marketplaces and there are some co-ops that you are still free to look at that, and I agree with everyone else. The point is for you to be an informed consumer and to be able to make those comparisons, whether it's through the private marketplace or through the private marketplaces or different things. Everyone's using the same term, or the federal marketplace. And the protections, the protections for the plans are all still there as well. And did we hit every aspect of your question there, sir? Just want to...
Well, let me
Mostly?
add, be-
Oh, the
because
same that will depend on the plan,
It-
just
it
like
also
it is now.
depends on the plan and the network
And-
and the
and the
plan.
network, yeah.
Now,
Just like right now, you want to look at what plans are being offered on the exchange/marketplace, and then you'll be able to look and see if your doctor's in that. And of course, that's always a consideration when people are thinking about insurance as to whether or not their doctor is going to be under that particular plan. So then you can make that assessment if the subsidy and the plans are worth staying in the marketplace/exchange, or you want to go and purchase it all on your own.
Yeah, and many insurance companies will be offering plans both on the federal marketplace and also in private areas. So as you're applying, be sure to ask which way you're going if you're working with someone.
just keep in mind with the federal marketplace, a family of four. I'm going to the top. I'm not going to go to the bottom. A family of four with a household income of $92,400 would still qualify for some type of subsidy. A family of four, and when you look at the average household in South Carolina, it's a lot of us. But a family of four with a household income of $92,400 will still qualify for some type of subsidy. So now the question is, if I'm looking at finding the best or the most affordable coverage for my family, why would I not at least look to see if this is going to be a better deal? Because it could give me the same coverage, I could have my same doctor, but with the subsidy, I actually would pay less on a monthly basis. And that way you make a better decision.
Are there any exemption to the insurers for the mandated coverages? I believe I was told by a representative from the state plan that somehow they were grandfathered and they don't have to cover some preventative care. And could somebody speak a little bit more about why individuals will not be covered if we don't expand Medicare?
If we don't expand Medicare or Medicaid? Oh, where's Lynn? Because she can probably answer this better with grandfathering. She's our insurance expert. I can't answer the Medicaid piece. People who are, there are a lot of people who don't have insurance right now who are so low income that if we had expanded Medicaid, they would have been eligible for Medicaid just because of their income. Right now, to be eligible for Medicaid in South Carolina, you have to fit into a category. You have to be a child at a certain income. You have to be a pregnant woman at a certain income. You have to be disabled on Social Security or, SSI. You can be elderly. and get a certain help with Medicaid. But if you are an adult who's poor and you don't have children, you have nothing available to you if you can't afford health insurance. And that's who's going to be left out by us not being able to expand Medicaid. A good bit of our workforce, as well as parents whose income is more than 50% of the federal poverty level. So if you make $7,500 or $7,600 a year and you have a child in your house, you might not be eligible for Medicaid now, and you won't be eligible for Medicaid later. Well, yes, you could, but if you're only making $7,500 or $7,600 a year, you don't have money to pay a subsidy.
And no community member, as I said, we'd have some folks that would probably be able to help educate all of us, but can speak to the grandfathering issue.
All employer plans under the Affordable Care Act have to, within a certain period of time, be a qualified plan, which means they have to offer the same set of comprehensive benefits that are available, that the plans that are on the federal health insurance marketplace are offering. The state of South Carolina, because it is self-funded, is exempt from that requirement. Any employer who self-funds, which means they have an ERISA plan, can be exempt from that, which means they don't have to offer all of the benefits. Primarily what they are not offering are the free preventive screenings. And unless you're with the plan at MUSC, and that's different.
Now, is that going forward, or does that change in 2014, 2015?
It changes whenever the Secretary of Health and Human Services decides that she wants to change it.
Okay.
I'd just like to ask this question. What's the possibility that this healthcare, affordable care, the Affordable Health Care Act could be repealed? Because on the congressional level, there's been a lot of discussion about whether or not it's going to continue to be in place. So if anybody could speak to that, I would appreciate it.
Well, we're really here today to talk about what's going on today and what you need to know for the law as it is right now. If prognosticating about any laws going into the future, that's really not what we're here for.
I think Congress is up to, 35 to 40 attempts to repeal, so it's just another.
If we keep doing that, then we don't have to talk about how we truly implement and help people have health care.
I'd like to address this to Ms. Pearson. I think you have a cooperative ministry connection there. We've all been sort of sensitized to the plight of the homeless among us, and I wonder if there's any kind of umbrella through cooperative ministries or otherwise to just bring some coverage to the people who are on the street. We want to see everybody covered, and we sure don't want to see them fall through the crack. Is there something you're aware of, some entity or through cooperative ministries that can help them?
Can I?
Eau Claire Health Cooperative provides services at the cooperative ministry. But seriously, I wish that were the case, but quite honestly, it is only through partnerships with people like Eau Claire Health Cooperative that we can offer any type of health service at all. That is really beyond the scope of our mission. And to the extent that we can help with prescriptions and that type of thing, that's pretty much what we're limited to based on the donations that we receive and that we can direct in that area.
We've partnered with cooperative ministries. I think I want to say May of 2012 is when we actually started seeing patients there. We have a small exam room right there at cooperative ministries where we can actually see folks who are uninsured or underinsured. In addition to that, transitions right on Main Street, we see folks, and transitions, because of its location, we're able to see folks from transitions, Oliver Gospel Mission, Hannah House, Christ Central, wherever if they're qualified, and to qualify, you got to be homeless. But we help with their medication as well. The key is trying to make sure, and we're talking about homeless, but this is everybody. If you have primary care, and your primary care is not going to be at the emergency department at a hospital, and you can receive the medicine that you need for whatever sicknesses or illnesses that you have, and a lot of times when it comes to the homeless or those who don't go to the doctor on a regular basis, their situation is more complex than others. So it's not just going to be a one-term fix. This is a process that you have to take them with, and you have to be willing to walk down that line with them. Now, what I've seen in working with the homeless, you have a lot of folks that qualify for Medicaid and Medicare. You have some folks that qualify for disability or SSI, but they haven't been walked down that road. So we're good at healthcare. That's what Eau Claire does. But as you partner with other agencies that are subject matter experts in what they are, then we don't waste a lot of funds and time, and two, we're able to serve the populations that we're choosing to serve in a more effective manner. And that's something that we've been doing, and we want to continue doing. But it's not just with the homeless. We also have an innovations program, and these are folks who may have some insurance, or they may not be homeless, but they are homebound, and they get the services from cooperative ministries. But we have nurses and nurse practitioners that are going out in the community and helping to serve them, and also providing medication through patient assistance program where they can actually get their medication at little or no cost. You're welcome.
Where is our roving mic for the next question? Oh, wonderful. I'm sorry, I couldn't see you with the pillar right there.
Watching your slides this evening, I noticed, well, first, thank y'all for being here and taking our questions tonight. Thank y'all. You said in 2014 the fee will be $95 or 1%, whichever is greater. And then in 2016 it'll balloon to $6.95 or 2.5% of your income, whichever is greater. That's a 730-something% increase over 2 years. Do you see your premiums going up a good amount in those 2 years as well? Do you know if those are going to go up? Because we don't know the cost yet, but can you answer that a little bit?
The penalty goes, I mean, the penalty, when you look at what is being assessed in the beginning, it's not a very harsh penalty. It's not a lot. I think the reason it goes up is it's the hope that people will recognize all the wonderful benefits of the Affordable Care Act, and actually the more people who enroll in the marketplace and participate in the health care insurance pool will help keep all of our premiums down. Part of the reason premiums go up is that I always like to say health care isn't free. I don't care if people say it's free. Somebody's got to get paid. You know, none of us work because, I mean, we work in what we do because we love it and we care, but we also have to pay our bills. And so when people are going to the hospitals and they're not able to pay, that gets cost shifted. If people actually have insurance and the private market pays, which is what the Affordable Care Act is about, the private market with private health insurance paying bills, then we should not see even close to that kind of, I feel confident we won't see increases that are substantial. I know right now we had a 35% increase for our small office. It's got to get better for us.
So, the mic. Have someone right here in the front.
Thank you. I just have a question about small businesses. Where do we fit in to this? I mean, I just got a letter from Blue Cross Blue Shield of South Carolina saying that they're going to cancel our insurance. I have 5 people in my company, and I just need to know where we need to go from there. And paperwork that we have to supply to our employees, there's some kind of form that we need to supply by October 1st.
Yes, ma'am.
There's 2 forms for employee, whatever, if we're giving them marketplace or whatever. I just need to know these things so I don't get hit from my employee for not doing it.
Do you work directly with Blue Cross Blue Shield, or do you have an insurance agent
I have an
broker?
agent, and he's kind of like,
Well, you know
it's
what?
fresh, it's all fresh to him too.
Well, it may be fresh to him, but you're paying him 20% of your premium each month to know this. That's what the average broker is making off of premiums in
Okay.
South Carolina. So I suggest you go and talk to him or her and make sure they help you. I think one of the things that you can do, there's two ways you can go. You can keep your insurance going after December 31st, or it may make sense for everybody to go into the marketplace. It might end up
That's
being
what I'm
more
thinking.
affordable. And I think that's where you can do some education with yourself and your employees to make sure you meet the deadline that Wanda was talking about, so there's no gap in insurance.
And if you're comfortable sharing your name and some contact information, also if we can connect you with folks with the Small Business Chamber of Commerce or with the Chamber of Commerce for some of the specific cases with that. And anyone else who has those types of questions too. And that might be one of the things that we need to have another forum on, focused on
Yeah, that's what I
for
was
small
thinking.
businesses.
That's what I was hoping, some
Okay.
forum for small
Okay,
businesses.
thank you, but we can,
The
I think.
required paperwork that we need.
I was just going to say that the small business market is one that the navigators are trained to serve.
Oh, wonderful.
So
Yeah.
we can help you with those questions as well. It's long story short, it's a two-stage process. The employer has to set up the account, has to actually choose a plan, provide the names of the eligible employees, and then the employees come in on their own and decide at what level they want to participate.
And if you look at the marketplace, if you go online and check the marketplace and just search shop, that's for your small businesses. One full-time employee, and you would be eligible to go in the marketplace. So if it's you and one full-time employee, then you can look at the marketplace and explore your coverage options.
Well, full-time equivalents.
Yeah,
So if you've got 4 people that work, 10 hours a week, then that's your FTE.
Is it feasible that employers will now see this as an opportunity to not have coverage of their employees, and they'll say that now employees have access to the Affordable Care Act, and we no longer have to provide benefits, so that major employers or even small business employers will no longer have benefits available? And also, will the option be available for employees who might say, let me shop around and maybe the Affordable Health Care Act will provide lower premiums than what I'm paying for through my employer?
The answer to both questions is probably yes. I can't speak for small businesses. That's a decision that the owners are going to be making on their own. But for employees, yes, you do have the option of not participating in a plan that's offered in the workplace. The downside to that, though, is that if you purchase a plan through the marketplace/exchange, then you would not be eligible for the cost sharing through the premium tax credits or any other types of subsidies, advanced premium tax credits or other subsidies. So yes, you do have the option of doing that, but you just have to explore whether or not that's going to be the best route for you to go.
I want to say something, and I want to make sure this comes out the right way. So if it doesn't come out the right way, please forgive me. My grandfather told me something when I was little. He said that when you get a job, if you agree on a pay, then that's what you agree on. So if my job says it's going to pay me X amount of dollars an hour, and I agree on that, then I can't be upset if that's all they pay me. That's what I agreed on. Does that make sense? The benefit part is extra. And they tell you the benefits that they actually offer, and then you make determinations of if you're going to use that benefits. Now, this is small businesses and large businesses, and I'm seeing this every day, and I shake my head. And I'm not putting anybody on Front Street because it's already in the news, so it's the facts. When you have UPS saying that we're not going to cover some spouses anymore because that's the decision that we're making, now these families are going to have to adjust. When you have families who've retired from IBM and somebody else that said that they're going to change the benefits that they're offering. At their discretion, they can do that. I'm not saying it's right or it's wrong, but at their discretion, they're able to do that. Here's the beauty about affordable care. It puts more leverage back in your hands. Because now I can say, what's going to be best for me and my family? And for a long time, I could have been getting some coverage for my job, and this is like the worst coverage ever. This coverage ain't where I pay X amount of dollars on a monthly basis, and when I go to the doctor, I still got to pay X amount of dollars on a monthly basis. What am I paying for? Maybe that was just me. I don't know. But to have a better option and to now infuse something in the system where it forces the system to check itself. And now we have to regulate. Now we can ask questions. What have you been doing with this money? What kind of coverage are you offering? What do you mean that you're telling somebody that they can't have a surgery that their doctor told them that they're supposed to have because as far as you're concerned, you don't deem it necessary? What are we doing? Is that right or is that wrong? And for a mother who has a child, for a father who has a daughter who's 5 years old, who is still undiagnosed, she has an undiagnosed metabolic disorder, and we've gone from South Carolina to Duke University, and if it wasn't for the fact that we went to Duke University, we wouldn't have qualified for Medicare because South Carolina said you don't qualify because you make too much. I'm like, what are you talking about? My wife doesn't work. It's just me. I have 5 people in my household, and you're saying I make too much. My daughter's medical bills exceeded $2 million before she was 6 months old. And I am not the only one. So what is it going to be for a family, and my wife, educated, very smart, smarter than I, who was able to stay home, and she became the primary caregiver for my daughter. She made the rounds with the doctors. She has notebooks upon notebooks of different information from the time my daughter was a day old until she'll be 6 in September. This is September 23rd, she'll be 6. And she has documentation, but what about the single mom who can't do that because I gotta work to keep the lights on? I can't afford to stay out of work to take care of my child. And there are things that's out there that I should be able to have access to, and I don't have access to it because somebody's trying to deny my rights, and now my daughter suffers or my son suffers. How fair is that? So let's level the playing field as much as possible for regular folks like us.
I just wanted to thank our panelists